What's coming down the pipeline for patients?
In preparation for surgery, and patients wait for surgery in our system, unfortunately, we should take advantage of that time and optimize them from a nutritional, physical, and medical perspective, as well as psychologically. So the opportunity is, how do you track them during that period of time where they're going through rehabilitation? In the past, they would come into the hospital 3 or 4 times a week. You would put them on various machines. You would test their exercise capacity, weigh them, etc. Now, with wearables and different types of sensors, we can track them continuously at home, and that information can be fed to us. It could be digested using artificial intelligence, and we could see whether patients follow a trajectory that we expect. That concept has been really powerful, and we've shown that using rehabilitation, we could decrease complications and even improve survival after cancer surgery. We've taken that same principle now and we're applying it to recovery after surgery so that we could monitor a patient in their own home and see that they are recovering the way we anticipate that they should, and if not, bring them back in, identify what the problem is, and solve it before it becomes a full-blown complication.
Dr. Touyz, the biggest challenge in your view facing innovation in healthcare?
Science has become very, very expensive, and we can't all be experts in one field. So I think bringing the expertise together and innovating through teams is the way we need to go. And I think also in terms of innovation and building into the clip and to everything that Ed has said, is the importance of bringing the non-traditional scientists to work side by side with our clinicians, with our biologists, bringing the physicists, the mathematicians, the computer scientists, the engineers, even the world of art should be working together in this world, in this ecosystem.